歡迎大家出席今
Welcome to today's press briefing. May I introduce the speakers today? From the Department of Health, Dr. Chan Shuk-kwan, Head of Communicable Disease Branch for the Center for Health Protection, and Dr. Sarah Ho of Hospital Authority. And first, we have Dr. Chuang to report on the local cases. As of now, we have 30 confirmed cases, 358. From 358 to case 387, and 12 men and 12 female and 18 men, and 19 of those with travel history, and 2 are students, and 1 with a travel history from Macau. So we'll look into it whether it's a probable local infection or Macau transmission, and one of which is a flight attendant from Cathay Pacific. Another is a tour guide. For those without travel history, there's one family cluster, even though they have no travel history, and yet the family members belong to is a confirmed case. And for the Lan Kwai Fong musician cluster, we have a few more confirmed cases. Case 360, 362, 367, 384, and 386, and 387. And together with 2 individuals, early case 276 and 343. For the musician cluster, one was a server at the pub, but not one of the musicians. And for the Changlong Industrial Building in Changsha, we had 1 more confirmed case, which is a colleague at work, case 372. And for the Wang Chok Hang private gathering, we have 1 more convicted confirmed case, case 375. And that private function we now identify 5 confirmed cases. Case 169, 277, 208, 315, and 375. And for the wedding banquet, we have 1 more confirmed case, case 373. And we have a total 10 confirmed cases for the wedding banquet so far. And for those without travel history or untraceable, with a case 377, and of those with travel history, we have a newly arrived foreign domestic helper, case 383. As we will perform tracking, and we'll tell their friends to get in touch with us, and we'll also advise those who hang out with them to go see a doctor. So we have a few more asymptomatic cases. Of the 30 confirmed cases, 3 of them are asymptomatic. Case 372, 366, and 375. For case 366, and we handled the specimen container to that person to obtain as saliva specimen. And he began feeling unwell after obtaining the container, but still showing symptoms. That's all I report today. Thank you, Dr. Chuang. I now have Dr. Sarah tell the HA situation. As of midday today, over the past 24 hours, the hospital authority has reported 248 suspected cases. And together with those still admitted, we currently have 448 patients requiring treatment. Over the past 24 hours, we have 1 patient discharged. This patient is a case 93. As of now, we have 102 patients recovered and discharged. There are 251 patients scattered across 13 hospitals, and 4 of them in critical condition. And for the case reported, 3 British cases, 119, 192, and case 312. And case 338, and yesterday he had more shortness of breath and required intubation and on the breathing machine. And 1 more patient have entered serious condition, case 159. And out of the 246 are in a stable condition. We have 1 healthcare workers, as his family member were diagnosed as that would be required put under quarantine. As of midday today, the number of negative pressure beds stand at 971. Compared to yesterday, we have 17 more. And for the negative pressure wards stand at 514, an increase of 7 from yesterday. The utilization are 51% and 71% respectively. As you notice, our colleagues have been working very hard to increase the number of negative pressure wards and the relevant manpower. As we expected, there will be more demand for such facilities from patients, and hope that the public could understand and cooperate with the healthcare workers. If we had a rise of admissions, no matter how many new beds been created and how many manpower we have assigned, our capacity eventually we're not able to cope with this. Thus, I strongly appeal to the public to cooperate. And please do not go out unless it's absolutely necessary. If you must go out, please avoid crowded places. If you need to go to crowded places, and please shorten your duration of stay and maintain personal hygiene, put on your mask, and wash your hands frequently. And which would be the biggest support to our healthcare workers. And the hospital authority, out of consideration that in the restaurant there will be a special arrangement in place for patients and the visitors. We will only offer them takeaway, but no dine-in services. This measure would help to reduce their stay in the cafeteria and reduce the risk of transmission, and so as to reduce the impact of hospital operations. And also remind the patients, and after visiting the doctor, if you're hungry, and please do not stay for too long at the cafeteria, and will not consume the food outside those cafeterias, as the hospital is considered a high-risk area. Whether for visitors or patients, they should reduce their stay at duration at hospital to reduce the risk of cross-infection. Thus, once again, I'd appeal to the public and the patients to cooperate. So that's the end of my report.
Now it's question time. Please raise your hand and use the microphone given to you. Please introduce the organization you represent, and you're limited to 3 questions. The lady over here. I'm from cable TV. I'd like to ask about the news of home quarantine confinees wearing their wristband and going out. So far, how many cases have you received under which people have broken the quarantine order? Any of them being arrested? Now, if a considerable number of people can wear their wristband and go out, does it show that the wristband doesn't work? The second question, there are still some local cases with unknown source. So far, have you identified some of the sources of previous cases? Yesterday, well, there were some new measures impose, say, for example, prohibition of a sale of alcohol. Given the serious situation, as stated by the CHP, do you recommend a more stringent control, say, for example, restricting the operating hours of restaurants and bars? We are aware of some reports saying that people under home quarantine have gone out and they have contravened the quarantine order. If that is the case, they will be fined and they will be imprisoned for 6 months and a fine of $25,000. It is a serious case. Students coming back from overseas or other people, maybe some of them are quite young and they do not understand the gravity of the situation. So they should be reminded. I know that so far 408 warning letters have been sent by the Department of Health. Soon as we know about these cases, we will seek the assistance of the police. Some of them have been located and sent to quarantine camps. As to whether there will be any prosecution, we will have to seek legal advice to see what evidence we have. I don't have the number of figures, the number of cases. For local cases, we endeavor to find out the traces. Some might be related to those who have traveled. Say, for example, there was one case. It's within a company. It's case number 338. At the beginning, we could not find the source. Now we have found that it is related to case 229 and 337. However, there are still some cases without a clear source. They might seem to be related cases, but they are not actually related to imported cases. Next, second row. Restaurants. I know that the government is trying their best to see if more stringent measures are required. If we need legislative amendment to impose restrictions or a ban, then we need to do some legislative work and it will take time. Next. I'm from Hong Kong 01. I'd like to ask about information of cases. The Lan Kwai Fong cluster, there has been a number of additional cases. What is the relationship amongst them? How many of the cases are preliminary positive cases? When was symptom onset? Which restaurants have they been? In relation to Studio 9, how many other people are preliminary confirmed cases? You have asked the organizer, can you successfully locate all the participants? How many of them have symptoms? We received information that from the Queen Elizabeth Hospital, there was a preliminary confirmed case. It's a 47-year-old male working in a bank, and in February and March, he went to the UK. Which bank and what post? Dr. Lee, the chairman of Doctors Association, said that at the beginning of last month, there are some government officials at the Hong Kong-Zhuhai Macau Bridge say that they are stopped from wearing protective gear so as not to scare other people, and that they should not deploy inexperienced staff to these locations. So are there any guidelines? And in relation to deploying staff of member to high-risk places, have they received sufficient training? Are there any space at the Asia Expo, World Expo to change their gear or to have dedicated toilets? Is it the case that they have to reuse their masks and their face shield? Of the cases you mentioned today, how many of them are related to those who are under home quarantine? And do their family members show any symptoms? There are a number of questions. The Wong Chuk Hang party. We have contacted the organizer. We have contacted or reached out all those participants. They are aware of the situation. If they show symptoms, they would have gone to hospitals. There might be some preliminary positive cases, but I don't have the exact figure. There are some people without any symptoms, but still they went to hospitals. If the case is not related to their occupation or they have not been to work at all, say they have traveled and they have not gone to work upon their return to Hong Kong, we will not disclose the name of the building or the details of the patient. Regarding the Asia World Expos, well, no Department of Healthcare staff are deployed there. We only deal with people who have been triaged, and those without symptoms will only be given a quarantine order. About the doctor who is a confirmed case, the close contacts are at this point of time negative in their testing. We know that as soon as we learn about the confirmed case of a doctor, DOH have made some suggestions and given some advice about enhancement of infection control measures. The Lan Kwai Fong case. The confirmed cases that I've mentioned are from the same band. They play music together. And there is another case. Is a waiter or waitress from the bar. What are the case numbers? 276 and 434, 362, 367, 384, and 387, as well as 386. They play music together. They are from the same band. They sang at the bar, 386 and 387. Some play on the keyboard and some vocal. And they would spend their night in Lan Kwai Fong, and some of them will go somewhere else. Next. I'm from commercial radio. I would like to ask about the rumors that there is a staff member from a television station who is a confirmed case. I'd like to ask if that is true. If the occupation is not listed, does it mean that after symptom onset they have not gone to work? I want to ask if there are any close contacts. I want to ask about the case of the confirmed case of a doctor. Some frontline healthcare workers have said that there has been an insufficient protective gear given to them. Have you done any assessment as to that is the case? And I see that there are some cities in Hubei province that are still closed, then they would go back to Hong Kong via Shenzhen Bay. Will they be given the smart wristband? We've learned from some reports that they are only asked to go through home quarantine, and they have not been given any wristband, although they have been given a vial for specimen. They have not been given any vials for specimen. Will the DOH give them the vials to collect samples?
Today we have a confirmed case without travel history that works in the media. Well, we're still investigating the source. For example, whether family members or friends are feeling unwell or those with travel history, though they're still under investigation. Can you provide a case number? 377. And how did the Department of Health doctor got infected? We have yet to reach a conclusion. Since she worked at the airport and been around at the airport, so besides working, there might be opportunities to go grab a bite or use the bathroom. which may give rise to infection. For example, if you remove your mask or your face shield, and whether you fully follow the hand washing procedures, which may give rise to infection. However, her line of work is not particularly risky. It's really dealing with asymptomatic travelers, which may come across on the streets instead of those with respiratory symptoms, just issuing quarantine orders and taking questions. So their line of work is not really particularly risky, does not require a full protective gear, such as those dealing with confirmed cases. Of course, we will offer them face shields just in case they're concerned. Besides a mask and gloves, we also issue face shields. And after this confirmed case, our infection control colleagues will offer suggestions, and in depends on individual circumstances, they will also step up the infection control. For the Hubei cases, they will be put for the Hubei returnees, they were put under home quarantine. Well, the Hubei seems to be doing a better job than the rest of the country in general. So we just target the high-risk areas first. Xinjiang Daily News. I'd like to ask about the case details. For the Lan Kwai Fong band cluster, when they have visited a few establishments in a single day, and you see there's a server at a bar that got infected, may I ask the Department of Health, have you reached out to the bar and restaurant employees for the Wangchukang party? So what was the party about, and how many people the Department of Health managed to reach among the over 100 attendants? And on the airport doctor case, there was reported that she might be working on 12 hours shifts. That this excessively long working hours have heightened her risk of infection. And you mentioned that we're offering suggestions. What kind of suggestion recommendations that was that had to do with the staff equipment, as whether they are under-equipped? And what is the utilization of the quarantine centers? And you can see we see a spike of confirmed cases with a few clusters. So what is the current utilization? And we consider increasing the number of quarantine centers. There's 5 or 6 people in the band. From what we know, they have been to a few places, for example, like Center Stage, Insomnia, and Dust Till Dawn. They might have been to other bars to perform, so we need to ask more questions. And we have requested those places we mentioned for thorough cleaning and inquire whether the employees got any symptoms. On the quarantine centers, I don't have the figures at hand, but I know that there's still got a spare capacity. If we reach capacity, we'll increase the capacity. As for the long working hours, as I understand this period that we'll be working for longer hours. And besides our own staff, there are other service units which allows to deploy staff, and we shall step up training. And before this, we could offer them orientation and training so that they should know what to take note of, especially. What kind of activities were they involved in? So that's an open, large space. It's just some tables where people will be drinking and chatting with music in the background. And how many people you managed to reach? We had to work out a tally. Well, quite a sizable crowd. I hope that the organizer can spread the news to the attendees first, and they should see a doctor as they're showing symptoms. Then we will get a better picture.
So about the wristband, because some people have been seen flouting the home quarantine rules, so how effective do you think the wristband is working? And you said that some people who have violated the rules have been found. So how many cases have not been found and are still on the loose? And then secondly, about the doctor case announced yesterday. So the doctor came down with the virus because after working for 6 days in a row. So would you say the manpower has been overstretched? And some news say that the medics at the border checkpoints are ill-informed and they have not been dealing with infectious disease. So did they receive training before working at the border checkpoints? And thirdly, about the Hubei residents, as they are going to be allowed to leave the province, and would you have measures, for example, asking them to wear the wristbands if they are allowed to go back to Hong Kong? Thank you.
For the confinees of the home confinement, receiving home confinement order, it is violating the law to go out their house to the place of confinement. We are receiving some reports and we are asking the police to help us to trace them. And some of them have been traced, but the exact number I do not have. But I understand some of them have been put under camp quarantine for those who have violating the home confinement rule. And if there's enough evidence, we will seek the advice from the Director of Justice and see whether we need to do prosecution. So it is against the law to violate the home confinement order, and if being prosecuted, they will be fined, either be fined for $25,000 or put into prison for 6 months. So for the daughter case, I want to update you that the close contact of the daughter case from the Department of Health has been tested so far negative. So we will arrange, every time they post to a new post, we will have briefing to them on the type of job and the necessary precautions. So we'll try to step up this type of training. And for the mainlanders, including Hubei returnees, we have the law to ask them to put under home quarantine. Yeah.
下一位嗰邊第二行中間嗰位女士。
The lady in the second row. Mingpao Daily News. I would like to ask Dr. Chuang. The first question: of the confirmed band members, and for the early cases, for those who hang out in Lan Kwai Fong, do you know where they come across each other? Have they been visiting the same locations? And during did they wear surgical masks while playing music? Would you see that band jamming and playing music at high-risk activities? And for the radio transmission, it might have to do with touching musical instrument as a way to spreading the virus. As for the tour guide, and what's case number is that? Is this a local tour guide? And which travel agency did it work for? And which tour group had he led? And how many close contacts? And for case 371, they claim to visit Macau. And Macau claimed they are almost free of community transmission. And which part of Macau has he visited? Have you been to casinos and other locations? And how to determine is that a local infection or a Macau infection case? And thirdly, as for the family cluster as cited by Dr. Chuang, and which case number is it linked to, and where had they been, and where did they live?
So.
For the band members, they are African ethnicity. They are quite close to one another because they play in the same band, and when they play, they did not wear a mask. For these places, people gather together, and people would be in high spirits. So at a time like this, it's a high-risk activity. Well, given that even having a meal together is already high risk. For case 366 is the tour guide. The tour guide took a tour to Turkey, Spain, and Portugal. Is EGL tour between the 7th and between the 7th and the 27th, and starting from early March, the 3rd of March, there was a fever, and it's a tour of about 20 people. It's a quarantine confinee, so he's been issued a vial when they left the plane, and on the 22nd, the sample was returned, and it was found that it was a confirmed case, and it was on the 23rd that there was symptom onset. In relation to case number 372, the person has been to Macau and visited a number of casinos and have been going about in Macau between the 8th of March to the 11th. He's taken some coaches and he's taken some public transportation. We don't know whether he caught the virus in Macau or Hong Kong, but he's been to some places where there were a lot of people. However, given the few number of cases in Macau, maybe he caught the virus in Hong Kong. For the family cluster, is case number 359. The son is case 195. The wife is case 322. The one in the middle. I'm from TVB. I'd like to ask a question that has been asked before. Do you have any figures about the number of people who have contravened the home quarantine orders? Will you prosecute them? We've seen two cases. Is the young girl in Shek Mun, and there's also a male in Chun Wan. He has a fever, has been taken to hospital. So are they confirmed cases or are they preliminary positive cases? What about the waiter in Lang Kwai Fong? Is the bar still operating? And how many close contacts have you traced? Are there any customers? In relation to the female doctor at the airport, people are very concerned about the route of transmission. Well, it is said that there is a sufficient protective gear. There is a chance that the infection took place during meals or rest. Have you done any investigation as to how it occurred? In relation to the number of cases of contravention of the quarantine orders, we don't know. I understand that people will be traced and tracked if we receive a complaint. For the first evening, there were 4, and they've been sent to quarantine centers. Subsequent cases are being followed up, but as to how many people have been located and how many of them have actually flouted the quarantine order, I don't know. Customers of bars. There is some people have been to Lang Kwai Fong, and they've been to a number of places. Well, it seems that some of them have been to some of the places I just named. But as to whether they got infected at that location or from a number of locations, we can't confirm. It's just that there are a number of names that keep popping up. Well, for the Department of Health case, there's only one. We have not found any related cases from the close contact. There is a chance that we will not be able to find out where the infection took place. We may have to wait for a bit more longer or to see if there are other cases. If there is only one single case, we may not be able to find out in the end. The first row, the gentleman. I'm from In Media. first question is about the doctor in a confirmed case. Will there be any measures to enhance protective equipment for those working at the airport? Second question is about the confirmed cases in Lan Kwai Fong. Do you think that prohibition on sale of liquor or restrictions will be effective? And I'd like to ask also the Cathay Pacific crew member, how did the infection take place, and what places has that person been to? Well, infection control experts have been to the location to see if there are any ways to enhance infection control and how we can make us colleagues more, well, confident in dealing with visitors. Well, if they are in contact with the passengers or the visitors, they have face masks, they have face shield, and they have gloves. Basically, that is sufficient, and they don't have to worry. Infection control colleagues have given us some suggestions about ways to improve. Prohibition of a sale of liquor. To a certain extent, it will be effective if you want to go to a place to have a drink, to socialize. If you can't get alcoholic drinks, it may help. But of course, you have to stop not just socializing where you drink. You have to stop social activities because it doesn't really matter what you're doing. If you let your guard down and if you are not properly protected, there is always a risk of infection. That's why we see a higher number of cases among families, because they share the same flat, they share the same toilet, and they eat together. Well, unless they eat at different times and separately, there is always a higher chance of infection, but that is difficult to do. What about the Cathay Pacific case? The Cathay Pacific case is case number 376. The patient's been to Spain and stayed between the 7th to the 11th of March. It's difficult to say whether they've been infected on board the plane when working or in Spain. On the 7th of March, they worked in the CX315. It is the business class. The return is CX320 on the 11th of March. Next, the gentleman at the back.
Apple Daily. We have so many cases in Lan Kwai Fong. You mentioned the bar cluster. And have your colleague have taken environmental samples? And would you consider conducting environmental sample like you do in Hongmei House? If not, reason why? Or you can do it afterwards. No, there's a case of a Hubei returnee, and he requested a home quarantine, and you tried to resort to a home quarantine instead of quarantine center as soon as possible. He yet to get any wristband. Can you explain why those from the airport were given wristband, but while those returning from Hubei through the law would not get a wristband? Was there a reason for this difference? And a question for HA. We heard that we have more beds and wards. And where do they come from? Is it through retrofitting or converting the negative general medical wards? And what's the progress of retrofitting? You claimed that at the end of this month they'll be ready. So what's the latest update? We went down to Lan Kwai Fong to do a sampling, because it's not that all the cases are grouped in the same location. Well, some cases we found that some particular cases have notched more than one cases. As for on the first case, we request them to do a thorough cleaning, so as to remove the source of infection. Well, if we go down after their cleanup, they might be too meaningful. Well, does that mean that we have to order a second cleaning when we get a second confirmed case? I read it from the literature or from the evidence we gathered. We know that some of the locations will have easier to get environmental samples, for example, like handles and bathrooms, where the chances are higher. As soon as we hear cases, even there's only one single case, and we will order them to do a thorough cleaning. And the Buddhist worship place at one story, because there have cases on a single location, and that's why we want to have the epidemiological investigation on trace the sources. Does that mean that there are a virus in the premises instead of the human-to-human transmission? Of course not. Even though they have cleansed the environment, we have people coming in or the virus carrier entering. Well, and even if we're two people getting really intimate, there's still a chance of transmission. Well, having a thorough cleanse doesn't mean they will have an exterminated chance of infection. What the Hubei returners, they were invoking the Cap 99C, which is another regulations, while those European arrivals are using this new regulation. We see that there are more cases coming from Europe and Americas and the rest of the world, while the mainland seems to be doing a better job. And for the wristband, we'll target the foreign arrivals instead. And Dr. Ho, as for the number of new negative pressure wards and beds, and where do they come from? Well, those are one were built in negative pressure facilities, and you can see there are more patients having this demand. That's why we activate the facilities to receive these patients. As for the pilot scheme to convert general medical wards with negative pressure, our scope is end of March and is currently on track. So by the end of March, our 7 clusters will offer 400 additional beds. On the 4th row. Hong Kong Economic Journal. I'd like to follow up on the Lan Kwai Fong band. So it was mentioned that do not wear masks while playing music. And who would you classify as close contacts? Does that include the servers at the bars? And we need to trace the patrons as well. And have they told you when had to visit those 3 places, or would they perform there every day? Will you appeal to the public to contact you if they've been to those 3 locations? And for the 366 tour guide, that you have hand out a saliva container jar for testing. And is it given a jar because you have a family member older than 65? And now that you have catch a few cases for this, and we consider expanding this testing. And for the case 332, confirmed yesterday, besides going hang out at Lan Kwai Fong, on the 13th, he also went to place at 43 Pottinger Street. And there were 4 confirmed cases that don't know each other. Was that like a restaurant or a bar? And what activities took place? And for case 332, know the other confirmed cases and know the number of attendees. One last question. Well, recently, there are those wearing wristbands that have went shopping or have a meal before entering home or taking public transport, which cause a public panic. And how do you improve the situation? For case 366, well, if they return from Americas or the UK, or will offer them a container. And if they return the sample, well, the following day, then we'll perform testing on them. So we will continue to strengthen. This is not limited of himself being 65 or with a fellow member of 65. So long as they return from the UK and those high-risk areas, we'll invite them to take the container home. Well, in order to identify asymptomatic travelers, so it will continue to be enhanced. It depends on the situation. And for case 332, I don't quite recall the address. They should have went to a launch called Kagashia. A few confirmed cases know of each other, while a few don't. So it's really in a bar and a lounge, whether they know each other or not, where they happen to be in the same space. And sometimes they would go bar hopping on the same night. That's why they could give out a few names on the locations. And well, for those who live with them or have the face-to-face contact and talk for 15 minutes or more without mask, or if both are not wearing masks in a confined space for 2 hours, not really talking to each other, but rather a very small confined space. For example, in a taxi, didn't open your windows, and the driver and the patron didn't wear a mask, or face-to-face chatting without mask for 15 minutes. If you want to track down all the bar patrons, that would take very long, and we're not able to fully locate them. So would rather resort through public appeal and disclosing the name of the premises. And so please be vigilant. If you've been to this place in incubation period, or you begin to feel unwell, you should see a doctor early. We're not expect all of them to call our hotline. Of course, we advise them to see a doctor because there's simply too many of them. The lady in the third row. RTHK. Professor Hopalang proposed that each company government to designate a infection control patrol. Would the DH issue such guidelines and appeal the companies to do so? And for those companies engaged in high-risk activities, would you suggest them to set up dirty teams to segregate different staff, as you see in some cases occurring in offices? And for the pure fitnesses, they have closed down for 2 weeks for cleansing. And for the bars in question, after the case reported, are you appeal them besides deep cleansing also closed for a fortnight? And third question, I'd like to follow up on 599C on the Shikang respite. I see the mainland resuming production, and also they also have relapse cases, and asymptomatic cases would not be included as diagnosed cases. So the DH assessed the risk, so that those covered by 599C to put on wristbands. And for the handling of containers to UK and your arrivals, when they start, and if so, and when would it commence?
Well, advice from experts will be fully considered by the government to see if there is any need to step up any measures. If companies are still operating, I suggest that infection control measures should be put in place. Say, for example, provision of hand gel, measuring body temperature, staggering work hours, not having meals together. If there is a dedicated person responsible for that, that is good. There are some, well, different companies may handle their premises differently. What we ask them to do is to thoroughly cleanse the premises. It's not difficult to clean, to remove the virus. All it takes is to just thoroughly clean the premises. We don't require them to close their doors for 14 days. It is their decision. That applies to other places, say, for example, restaurants. We do not require them to close down for 14 days. Assessment of risk from on the mainland and from other places is something that the government has been doing. There are some imported cases. We see that the main challenge lies in those cases that came in by plane. But we may consider other measures. Over there, second row, the one in beige.
My first question is about the warning letters. You said you issued 408. How many of those have been prosecuted? And as well, how many reports have you received of people going against violating the home quarantine rule? And how long would it take to trace? You said that you have asked the police to help trace those people who violated the quarantine rule. How long will it take to trace all of those that have violated the rule? And my second question is, if you said that even gatherings of people who are not drinking, if they let their guard down, they might also get infected, would you propose more stringent measures, say, for example, suggesting that the government ban gatherings of more than 10 people? And my third question is the waiter that was infected with the Lan Kwai Fong cluster, which restaurant or which bar was he working at? And will you release a full list of all the bars so that people know and can take precautions? Thank you.
I don't have the exact figure of the prosecution being made, but I understand some legal process is being carried out. I only have the figure of the warning letters, 408. Up to 23rd of March. So for certain cases, I'm sure if the legal advice suggests that prosecution should be going on, then they will proceed. I understand if the evidence of the violation is strong. I mean, you know where to find her or him, and according to those pictures or medias or videos, I understand the police can trace them quite quickly. For the past few days, I understand some of them can be traced within a day. And I think the social distancing is a measure that everyone should take. Of course, government can do something to ban certain places, to prevent gatherings, but it is the responsibility of the whole public, the general public, to avoid gathering. Because if you can ban some public events, but you can't ban some private gatherings, it's very difficult if there's home gatherings or gatherings in the private places. So the waiter is working in, actually for those clubs that the cases have visited before, after 2 days before the onset of symptoms during the infectious period, if they have visited the bars, we have released the building list. So you know that those places, for those buildings that the cases, more than one cases, who had visited a place during the incubation period, we also released those lists. So you know which list they have been visited in the building list. The waiter is working in the insomnia.
Next, over there, the gentleman in green. I'm from Hong Kong Economic Times. I'd like to ask about the wristband. Are there any difference in color? Say, white is home confinement, blue is close contact. And there are rumors on the internet saying that some people, after they have obtained the wristband, and when they get back to the premises where they should be confined, there is a 2-hour grace period. Would someone use that time to go out to shop and to eat? Would you suggest to them that upon receipt of the wristband, they have to proceed home immediately? And there are over 100 people who have recovered and discharged according to the HA. Have you done any investigation as to their health conditions? Are there any complications, and is there any chance of a relapse? I understand that there is only one color for the wristband. Close contacts will go to quarantine centers, so they will not be wearing a wristband and going about in the streets. For home confinees, it's one type of wristband. When they enter Hong Kong, we have to give them time to go back to the place of confinement. We give them a grace period, some leeway of about 2 hours. We ask them to make use of the 2 or 2.5 hours to go back home or to go back to the place of confinement and not go anywhere else. Just now, a question was asked about patients who have been discharged. As of today, there are 102 patients that have been discharged. 63 of them we have seen in a follow-up consultation, and we have made arrangements for the others to do so. The recovery is quite satisfactory. For some patients, we will ask them to do pulmonary function test. The lung function test is to see whether their lungs have been affected by the pneumonia. If we conduct the test too early, it's meaningless because the body will heal itself, and there are some rehabilitation treatment given to them. There might be some fibrosis in their lungs, and the situation may improve. The fibrosis will alleviate, and their lung function will improve. So we will give them several months before doing the lung function test. Then we will see that after a few months, after the body is trying to repair itself, in the end, what the lung function is like. So far, there are no patients that have done that test yet. If they have, we will give you the information. According to follow-up consultations, they've been recovering satisfactorily. Last 3 questions. Over here, first row. From Mad Dog. Well, every day we see dozens of cases, and still 251 patients are still in hospital. For the 4 patients in a critical condition, are they all on ventilators? Are you worried that you will run out of ventilators because there has been an increasing number? What will you do if that is the case? I'd also like to ask you about number of beds and wards. If the number of confirmed cases continue to climb, and if you run out of equipment, will you talk to private hospitals to ask them to loan them to you? Previously, there has been a number of babies that have been confirmed cases. What are their conditions? Will Wuhan pneumonia have different effect on young people? Will their conditions be more serious?
As for the 4 critical cases, they are in our ICU, and they rely on their wrist ventilators to help them breathe. As for the number of ventilators available, where the HA have stocked enough. Well, so far, we do have a good quantities of those, and we're not worried that we'll run out of those. Of course, For this group of patients are usually critical cases. At the same time, they're also infected with the coronavirus. Thus, they will be put on our ICU, and all the features of the negative pressure wards, which may put pressure on our services. That's why on the outset I appeal to the public that the hospital authority or the healthcare staff are really playing the gatekeeper role. Like Dr. Chung said, as we know that this coronavirus spread through our droplets and for human to human transmission. As soon as we're willing to work together to cut off the chain of transmission, then we will stand a chance to reduce and delay the spread of disease. And so we need to work together to fight this epidemic. As for the confirmed children cases, we have about 10 children confirmed. And some of these, they're looking at the literature and the Wuhan and other countries' experience that the children's symptoms are usually more moderate, and some of them will not and only rely on a supportive treatment and would not need antiviral drugs and would slowly recover. And on the statistic, I have a small number of patients that having a fever and pneumonia symptoms that are comparatively more severe. Our pediatrician and infection control specialists have looked into these cases, and on the balance of the risk, as some of the patients have been prescribed the antiviral medications. And after prescribing the medication, we can see seeing good results, and the fever had receded. And for those below 18 that are in stable condition. And private hospitals, and we have discussing various proposals. At the earlier time, we have some non-emergency services that reduced, and so as to vacate the capacity and the manpower to take care of these group of patients. So some of these services have been expanded. For example, the jaundice cases, and also at the elective surgery, and also on chemotherapy and cancer surgeries, and also orthopedic surgeries are still being discussed. The objective being to reducing the non-essential services at HA, so to vacate the manpower available for deployment. I hope that we can get assistance from all sides, but for this, we shall concentrate our manpower and resources on taking care of the confirmed virus patients. Into daily news. For the Lan Kwai Fong cluster, what's the name of the band concerned? For case 377, he works in the media. It's some that her girlfriend also works in the media. Has she been confirmed? And some healthcare workers complain that those working in an airport that they have a very small changing room and were not given protective suit and N95 respirators. And for those students studying abroad, it do not undergo compulsory quarantine and don't need to return the bottles, and would you mandate them to submit their samples? And some universities still not able to register their wristband and couldn't put through the hotline. Would you consider improving this? Well, for the name of the band, since there's so many of them confirmed, I've yet to ask for the name. And I've just disclosed to you which bars have they been to. However, I've yet to get the name of this band. For K377, there are yet to be any other cases associated with it or suspected cases. The testing is still underway, and we know the results very soon. If there are new developments, that we will let you know in the first instance. And for the wristbands, well, since there are too many arrivals, that there will be some kind of bottlenecks and so on. I know that they are improving. And please don't worry. As for some, will only activate the wristband a few days later. Does that mean they have the quarantine extended? Well, the quarantine order lasts for 14 days, and they already been serving the quarantine order. Activating the wristband and the smart app later does that mean they need to extend the quarantine period as well? Speaking on the mic. Our infection control colleague would advise on the right level of PPE. Not all will need to put on N95 respirators. Even those working in the hospitals, if they're dealing with ordinary cases and not work in negative pressure ward, they not necessarily must wear N95s. So there are some requirements to adhere to. The final row, stand use. And for the waiter in the bar, which bar they work in, and for the other staff in the bar will need to be under quarantine, and how many people we're talking about. For the Cathay flight attendant, and would you trace the business class passengers? And for the airport doctor's case, so you mentioned that mentioned working long hours, and the new report that there's no place for them to change the PPE, need to reuse their mask. Would that increase the risk of infection? Does that mean that staff training can resolve this problem instead of reviewing the arrangements? When you claim that not everyone will wear the N95, so what are the standards and requirements? So under what scenario and which part of the airport and which part of the quarantine work did they take that warrant the use of N95? The Macau chief executive mentioned that the home quarantine is very risky. They rather book the hotels as quarantine centers. Will the government consider this, or the hotel industry will not agree to this? Dr. Chen, and tell us from the perspective of infection control, is it better to do quarantine in hotels? For the waiter at the Lan Kwai Fong, and that he worked in insomnia. For each case, we trace the close contacts, whether they meet our criteria. If on 2 days before his onset and before he is admitted to the hospital, or before he began the isolation, and his any infection period, and any colleagues in touch with him, he may put under quarantine. Does that mean that means everyone works in the bar must be quarantined? It depends whether that person works in the infection period. And our infection control specialists went down to the airport and offered suggestions. There could be some updated arrangements. For the details, it really depends on the situation. And for when the N95 be used, for our colleagues, if they need to expose those with a virus and those symptoms, and those in the medical wards, and they will need to put on that N95 for the airport. Can you supplement?
There is an arrangement in place for Asia World Expo or North Lantau Hospital. We set them up as centers to receive returnees with symptoms. We will take samples or specimen from them. Healthcare workers will be fully geared up. Previously, reporters have been to these two facilities and they have taken photos. I have seen the photos on the internet, and I myself have been there. We have face shield N95, gloves, and protective overall, with this the full protective gear. Experts and the senior echelon of the government will decide where and whether there are sufficient facilities because of the sheer number of people coming back to Hong Kong. So far, we have under home quarantine as at the 23rd of March, those arriving from mainland, 1,898 people have been issued a quarantine order. From other places, we have issued 28,805 orders. That's the end of the press conference. Thank you. Which bar? In Lang Kwai Fong. The 6, let me tell you, the staff member, 360